Welcome to another episode of the Compounding Center Connections. We talk to our partnered healthcare practitioners on these podcasts and recordings about different healthcare conditions. I'm your host, Megan Kilkeary. I'm one of the pharmacists here at the Compounding Center in Leesburg. Our guest for today is Mr. Jim Paoletti. He is a pharmacist, a consultant. He has over 30 years experience, actually over 40 years experience in bioidentical replacement hormone therapy in clinical practice as a consultant and as an educator. Today, we're going to talk to Jim about adrenal dysfunction and ways to treat it. So Jim, thanks again for joining us. Jim's one of our trusted partners here at the Compounding Center who does consultations for us. And so give us a little bit about your background. Tell us about yourself.
Well, first, Megan, thanks for asking me to talk about one of my favorite subjects. The first presentation I did for the Compounding Centers way back was adrenals. So good to get back to that. I am graduated as a pharmacist. I don't call myself a pharmacist anymore because if you call yourself a pharmacist, people expect you to know about medications. I haven't dispensed medications for over 20 years. But I have been involved with functional medicine. I am an advanced fellow in functional medicine. So I've referred myself now as a functional medicine clinician. If you ask me pharmacy questions on some of the newer drugs, I may have to look it up.
Yeah.
But I've been working with hormones, like you said, 40 years. That is my passion. Whether it's educating practitioners on how to do this, whether it's helping patients get by their symptoms and establish a good, safe, beneficial hormone replacement program that's going to help protect their system as they get older. That's what I do from day to day. And adrenals is a big part of it.
It is, yeah. I can attest to that. Jim has helped thousands of patients over the years, if not more, tens of thousands of patients over the years, on their journey to health and wellness and to feeling better. So he is an invaluable asset to us here at the Compounding Center. And we really enjoy working with him. And he's been fantastic for our patients here. So we'll talk a little bit more at the end about how to get in touch with Jim or us here at the Compounding Center if you're interested in doing consultations with him. But let's get started. We are talking about adrenal dysfunction. So when you read through the list of adrenal fatigue, most people are going to be waving their hands in the air, jumping up and down and saying, that's me, that's me. So talk to me a little bit about, the functions of the adrenals and why, probably 90% of us out here today are in what we call adrenal fatigue.
Okay. Well, the function of the adrenals, if I could put it quite simply, they help us handle everything. One example is when we're younger, college age, we can pull all-nighters, okay? And we can actually go to class the next day and probably stay awake. When we hit 50, there's not that many of us that could even pull an all-nighter, and if we do, it's going to take us a week. That's lack of resiliency of the adrenal glands. But they help us handle not only stress, but physical, emotional, everything, okay? The reason so many people have problems, in my opinion, is really our adrenal glands weren't made to last for more than about 50 years. Performance. And if you look at the average age of women dying less than a century ago, it was 49. So what we do is we stress out our adrenals. That's the other problem. The reason why everybody has problems, look at our lifestyle.
Right.
Okay. We are go, go, go. I mean, you take a cell phone away from a 20-year-old for 15 minutes.
Yeah.
Okay? That's crazy. Because you're go, 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 constant input to the mind. Okay. Nothing to balance the stressors we do have in our life. I always say if we wanted to lessen the effects we have on adrenals today, we should go back to the old European way of, let's shut the entire world down, every business out there for an hour and a half to 2 hours at lunch. We'll all go home. We're going to have a lunch. We're going to talk with our loved ones. We're going to take a little siesta. And you can't go to the post office, grocery store, nothing. What is that? They're compensating for the stress of their lives by just taking a couple of hours and relaxing. That's not going to happen. So you're going to see more and more adrenal dysfunction in patients as time goes on. It's not going to let up. And that's why we have so many problems. It's just the constant state of go, 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 which is a mild stressor state that so many people are under continuously.
Right, that constant state of stimulation, and the adrenals are being constantly stimulated, and over time they burn out. So, you've addressed why we have issues. A lot of it is just our society and then the way, we're currently living right now. And so obviously one of the biggest things for people to do is to try to de-stress, right? How do we do that? What are some of the things that you tell patients? What do you recommend to people to do a little bit here?
Well, okay, when you look at the problem, we're stressed every day, and people want to compensate for that by taking an occasional day off. I had a gentleman one time, I asked him, what do you do to balance the stressors in your life? And he says, I ride my bicycle. I said, okay, how often do you ride? And he kind of hesitated. I said, when was the last time you rode it? He said, can't remember if it was 2 weekends ago or 3 weekends ago. I rode for several hours on Saturday. I said, dude, you're stressed 7 days a week, and you think riding a bicycle once every 3 weeks is going to compensate for that?
Right.
The first thing I tell people is, look, there are changes that go place in your mind when you are under stress chronically. And one of them is your stress reaction is intensified. So what happens over time is chronic stress leads to an increased stress response. What the patient perceives as a mild stressor, the signal going down the adrenal glands is that of a moderate or severe stressor.
Mm-hmm.
So one of the things you have to do is, if you want to recover your adrenal health and function and stay that way, is you have to teach your brain to chill out. So I go through how to do compensation techniques on a regular basis and how long they have to do it, et cetera, specific with each patient on how to get your brain to chill out and stop processing stress that way. At the same time, we're going to use things like nutritional supplements, adaptogens, because they work. The brain sends a message to the adrenals down what's called the HPA axis, hippocampus, pituitary, adrenals. The adaptogens, adrenal adaptogens, work on that HPA axis to blunt the message. So while we teach your brain to stop sending such an overrated, too hyped up message that you're stressed, we'll blunt it. We'll just dampen that signal. So those two are two of the most important things. There are other nutritional supplements. The adrenals, a lot of nutrition, depending upon what stage you're at, how low your cortisol is, et cetera. You're going to need to replenish those vitamins and minerals. And that the great thing about doing that, when you do that, you get energy back.
Yeah. Talk to me about diagnosing patients in adrenal dysfunction. I'm sure with your extensive background, you are probably able to do it without any laboratory findings at this point in your career. You're able to just talk to somebody or look at somebody and tell that they're in adrenal dysfunction, I'm sure, at this point. But as far as, talk to me a little bit about diagnosing someone and testing involved in that.
There are actually several things you have to put together. I mean, you're right. I appreciate your comments. I can pretty much look at a health questionnaire and tell whether there's a problem. And most of the time I can treat at least part of it without any testing. But I really would like to see a cortisol pattern and a couple other things. And here's why. I start with symptoms. I ask myself, does this patient have symptoms of high cortisol, weight, sleep disturbances, et cetera, et cetera? I look at all the, and then I also ask, does this person have symptoms of low cortisol, cravings for sweets, craving for sugar, low energy, et cetera, et cetera? Or does this patient have both? Which can happen. And that's part of my job, is explain to a patient why you have symptoms of both. That's one. Two, you want to look at your cortisol pattern throughout the day. You can have a perfectly normal morning cortisol. You can go flatline the rest of the day and have none, or you can go high the rest of the day. You can have a perfectly normal morning and night, and you can be flatline during the day or high. I need to know whether you're high or low throughout the day. Okay, so I do a 4-point saliva cortisol and get it, in the morning, noon, evening, and night. That gives a great picture of what your cortisol output and potential output is. So I put that together with symptoms, and then you also have to look at DHEA and testosterone. Well, I won't go into complications, but under different stages of stress, your DHEA and testosterone are elevated, and then they go down. DHEA is made 100% in your adrenal glands. And a woman, if you're still cycling, guess where 50% of your testosterone comes from? Your adrenal glands. Or I'm sorry, 25%. When you're no longer cycling, 50%. So I I sit down, I look at your symptoms, your cortisol pattern, your testosterone, your DHA, and I say, here's where you are on your adrenal function, and here's how we fix it.
Right. Real quick, I know you touched on some of those symptoms, but real quick, tell our listeners and our viewers what are probably the most common symptoms of adrenal dysfunction in people.
Initially, weight gain in the hips, or I always get this mixed up. High cortisol puts on weight in one place, hips or waist, and low cortisol puts it in the other. I always get it confused. I never remember which is which. So you go from high to low, you're going to add weight again in another spot. So it's just
right. It's just moving.
So weight gain, decreased libido.
Yeah.
The number one influence in libido is not testosterone. No, it's cortisol. In fact, every endocrine hormone affects every other endocrine hormone. But if you want one master switch, it's cortisol. So it's going to interfere with your estrogen working. High cortisol will cause hot flashes because the estrogen can't work. It'll cause sleep disturbances because your cortisol is going up at night. I'm sorry, that's your stimulant hormone. That's what shoots up in the morning to get you mentally and physically going. And then it goes down gradually during the day. Well, pretty quickly in the morning, but then through the rest of the day, gradually goes down to where it's low enough you can actually get to sleep. Well, if you have an abnormal cortisol problem, it's always going to interfere with sleep. Those are probably going to come. The other one is symptoms of low thyroid. Okay, cold body temperature, headaches, depression, weight gain, et cetera, et cetera, et cetera. Because high cortisol and low cortisol both interfere with thyroid function. So your symptoms you can go through this whole symptom list that we give out. Cortisol can be related to every one of them, but probably the top three for most women that see initially is weight gain, decreased libido, and sleep issues. And then secondary to that is all these thyroid functions. When you get low, the chief complaint, fatigue. Again, low libido, low cortisol decreases libido just like high cortisol does. So low libido, no sex drive, low thyroid function again, but fatigue's the big one when your cortisol starts dropping down low.
Sure. And I know you touched on as far as, testing, it's important to do multiple test points throughout the day because there's lots of different profiles that you see in patients in terms of, when it's high, when it's low, and based off of the symptoms that they're experiencing throughout the day. So I know, you're a fan of multiple test points, not just that one morning cortisol. That's not going to give you an accurate picture.
Correct. When I teach this class on adrenals, I will show different cortisol outputs throughout the day that I've seen. That's 20 minutes just to go through those. Here's all the possibilities I've seen. It varies so much with the individual, where their stresses are during the day and everything. And that's what you need to find too when you do the consult is what are your stressors, what time of day and night do they occur? And then you match that up with the cortisol output to figure out how to fix this patient best. When you're going to dose the adaptogens, how much you're going to dose, et cetera. You can individualize adrenal treatments quite easily when you get the full picture of information. Right.
So lead us into a little bit about the treatment. Obviously, we touched briefly on, the stressors in our environment that cause stimulation and will cause the adrenals to, burn out over time. So obviously, I know you recommend lifestyle changes. That's huge. What other things are you recommending for your patients?
Well, I usually explain these things in full at the consult, but to summarize, number one, avoid what stressors you can. Maybe people that are putting negative influence and stress on you that you don't need to be dealing with. There may be situations you can avoid. We can't avoid all our stresses, but you try to avoid the ones. Two, we're going to change your stress response. We're going to get your brain to stop overreacting to stress. We're going to blunt it in the meantime with adaptogens. We're going to replace your minerals and vitamins. And I have several different ways of doing that, depends upon where that person is on fatigue, et cetera. But usually an adrenal vitamin of some kind, throw in some little Celtic sea salt in there for quicker recovery. And then you're talking about things like how important is water. Here's how much water you got to take in. Did you know dehydration is a stress trigger?
Oh, no.
Yes. So everybody out there should be taking their weight in pounds. Cut that in half, and that's how much water you should be taking every day for adequate, normal rehydration. Of course, you add a little bit to that if you're adrenally dysfunctional. But protein's important to the adrenals on throughout the day basis. We do all that. Then you have to deal with the individual problems or issues that patient is having due to adrenal dysfunction, like sleep. It's it's going to take a little time, a month or two, to get this cortisol output regulated.
Right.
I need you to sleep sooner than that. So we're going to look at natural approaches to increase your sleep. I'm going to look at what your patterns are at home, how you sleep, how you set up the bedroom. We're going to talk about changing the environment. We're going to talk about that patient specific sleep pattern, trouble falling asleep, waking up, when they're waking up. We'll do everything from a protein snack at bedtime to trying some natural things. If need to, we'll do a neurotransmitter evaluation, and there is one available at no cost that does limited evaluation. But one of my goals with every patient is, if they're not sleeping well, I need them to sleep, and that's part of the adrenal issue. You're always going to see it when you have adrenal dysfunction, so you're going to work on that. And then on an individual basis, what other problems they have. If weight's a major concern, they don't want to wait 2 months for their adrenal regulation to be better off to address weight. So I'll talk to them about, hey, here's some lifestyle things, here's some nutritional things. If they're developing insulin resistance, which often follows adrenal dysfunction, that's adrenal insulin resistance, a little bit different. Give me a fasting insulin and a fasting glucose. Forget this hemoglobin, all that stuff. I'll tell you if you have insulin resistance developing in your body. But that's part of the adrenal issue. So I will address things we can do: lifestyle, dietary, movement, and nutritional supplements that can decrease the problems you have with insulin resistance. It's all tied into the adrenals. How far it goes, that comes to the individual. That's why I get the information on the health questionnaire and the test ahead of time. So I'm not treating generalities. I'm treating a specific person.
Right. Yeah, I always tell patients that come into us, how, it's not just adrenals, or it's not just hormones, or it's not just thyroid. These are all, tied in together, and you can't fix one without fixing the other ones. So, sometimes people will come in and they'll think, oh, I just need hormones and I'm going to feel better. And, to your point, no, we got to look at adrenals and, other things too, because if we forget to look at those and forget to fix those, we're never going to get your hormones where they need to be either. Everything, our bodies are these amazing systems where everything is just tied in, to each other. So it's a complex set of processes to fix. And to your credit, like you said earlier, it's not something that we're going to fix overnight either. So it's always important to encourage the patients to stick with it,
That's why we do our follow-ups. When you do a consultation with me, you are going to get follow-ups. And when it's adrenal, we might be working together for several months, because that's just what it takes sometimes. But I always tell patients, once you sign up with me, you're stuck with me now, because I'm going to get you better. I don't care how long it takes. Right.
We don't get sick overnight. So unfortunately, we don't also get better overnight either. So it takes time. So, well, Jim, thanks so much for, I know this was really just the tip of the iceberg when it comes to adrenals. And, when you do your consultations with patients, you really delve in with them, deeply and thoroughly. But thanks for just kind of giving us that 30,000 foot view of adrenals. If anyone is interested in reaching out to us here at the Compounding Center, or in reaching out to Jim for a consultation process, check at the end of our talk here today, and we'll give you the information on how to reach out to us if you're interested in either one of those things. And so thank you for tuning in to us today and listening to this podcast. And thanks again to Jim for your invaluable insight into this. As always, we look forward to seeing you next time. So thanks again, Jim.
Thanks, Megan.